Abortion advocates are using the coronavirus pandemic to push for looser restrictions on chemical abortions. Chemical abortions, also referred to as medication abortions or abortion pills, take place after a pregnant woman takes two pills, mifepristone and misoprostol, which kill her unborn child. The FDA requires the first of those pills to be administered by a certified prescriber and bans the sale of this drug by mail. Abortion advocates have long called for these regulations to be eliminated, and we're seeing a renewed push for this during the coronavirus pandemic. A coalition of Democratic attorney generals recently called on the Department of Health and Human Services and the FDA to remove the regulation, saying it is, quote, outdated. And even the New York Times editorial board recently called for making abortion pills available by mail, writing, quote, given the coronavirus pandemic, it is incumbent on the FDA to relax its regulation on mifepristone, at least temporarily. Joining us now via Skype is Dr. Christina Francis. She is chair of the board of the American Association of Pro-Life Obstetricians and Gynecologists. Dr. Francis, first off, can you outline the unique risks associated with abortion pills, also known as chemical abortions?
Certainly. This is a medication that definitely has dangers associated with it, which is why the FDA, when they originally approved this medication, put those REMS or those regulations in place to govern it. We know that they have immediate complications of hemorrhage, the possibility of infection, and the possibility of failure or where the pregnancy doesn't fully pass from the medication, then leading to the requirement for sometimes emergent surgery for that woman because of either ongoing bleeding or the risk of infection.
Do you suspect, Dr. Francis, we'll find out there was a rise in chemical abortions during this pandemic?
I definitely think that we will see a rise in that. Unfortunately, women are being influenced by fear right now, and this is being perpetuated by the abortion industry. Women are certainly, all of us are facing uncertain circumstances, but I know that there are a lot of women out there that find themselves pregnant right now and unsure of what they're going to do. Maybe they're facing the fact that they don't have a job right now, or they're struggling to put food on the table. But this is not a reason why we should be pushing women into abortions. And with many states suspending elective surgical procedures, we are hearing reports of more and more women obtaining medication abortions, as well as this push, as you said, by the abortion industry to release restrictions that are there. And those restrictions, let's make it clear, those restrictions are there to protect women from the potential dangers of this medication. The danger of using medication abortion through the mail or via telemedicine, where maybe the woman speaks with someone over a video call but doesn't actually see a physician in person, is that there are very strict regulations around how this is used for a reason. We know that the farther along in pregnancy this is used, the higher the risks, specifically the risk of hemorrhage and what we would call an incomplete abortion, where the woman doesn't pass all of the pregnancy from a result of the drugs. And also, these women need to be seen and screened to be sure that they actually have a pregnancy inside of the uterus as opposed to an ectopic pregnancy. If that goes undiagnosed, that could be lethal for her.
Do you think then there are additional risks to women who take the abortion pill during a pandemic and the fact we have these stay-at-home orders and so many places are closed right now?
Well, absolutely. This pandemic adds a whole new level of risk. One of the things that I have seen during this time is, women being packed into the waiting rooms of abortion facilities, and obviously that doesn't allow for the social distancing that we've all been told that we need to practice. The other thing is that we know that up to 7% of women will require surgeries to complete their abortion after taking the pills for a medication abortion. And so oftentimes those women will need to present to emergency rooms. And we know that emergency rooms are really the portal of entry into a hospital for patients with COVID. So that potentially puts the woman at risk of being exposed to COVID and, also adds additional strain on our healthcare system as they're trying to take care of the patients that are coming in with COVID. And then if we are adding more and more of these women needing care in our emergency rooms during this time, then obviously that puts her potentially at risk.
We're seeing, as we've been talking about, abortion advocates put the pressure on the FDA, though, to loosen restrictions on the abortion pill during this pandemic. Speaking as a medical doctor, what is your response to that?
Well, I think this is absolutely the wrong decision to make. And, this was actually something that was already going on prior to the COVID pandemic, but the push for the release of these regulations has increased even more as abortion proponents try to convince women through fear, I think, during this time that these are necessary procedures. We know that abortion is not healthcare. Does not treat a disease, and it actually has very significant risks for women. And so, women have the right to excellent healthcare even during a pandemic, and releasing regulations that were put into place for the protection of women is not the way to provide them with the healthcare that they need. In fact, it's putting their lives in danger. And I think women have the right to know this information. They have the right to know that these regulations are not in place in order to restrict them from being able to get an abortion, but they're in place so that if they do make that choice, that it can be done in the safest way possible for them. And again, having someone either send this to them through the mail or even talking to them over video, they have no way of confirming how far along in a pregnancy that woman is. And we know that especially at about 8 weeks, those risks start to go up, but especially after 10 weeks, those risks go up significantly. The risk of hemorrhage that might require a blood transfusion or, again, emergency surgery. And so, what we will see if these regulations are released, we will see an increase in the number of women that are having complications, potentially even life-threatening complications from their abortions.
Dr. Francis, sometimes we hear stories about women who take the first of 2 doses of the abortion pill and she regrets it. What advice would you have for a woman in that circumstance?
Sure. Well, I have had patients that have been in that very situation. We know that a lot of women make the decision to have an abortion under duress or because they find themselves in a crisis situation, such as the situation we find ourselves in now. And then after she takes that first pill, maybe she starts to think about the decision that she made. I had one person tell me that after she had taken that first pill, it was almost like this cloud of uncertainty had been lifted, and she was able to think clearly for the first time since she'd found out she was pregnant. And when she was able to think clearly, she realized that was not a decision that she wanted to have made, and so she wanted a way to change that. And thankfully, we now have a protocol in place called Abortion Pill Rescue, where if women change their minds after they've taken that first pill, they can call the network that's out there that will get them connected with a physician in their area who can try to help them reverse the effects of that first drug, the mifepristone. It's not 100%, but the studies that we have on it right now show that we've got about a 65% success rate of being able to save her child. And I'm happy to say that I've had one successful rescue, and it was one of the best deliveries I've done in my career.
Oh my goodness, that's beautiful. That's hopeful as well. Thank you so much for joining us and sharing your insight, Dr. Christina Francis of the American Association of Pro-Life Obstetricians and Gynecologists. Thank you.
Thank you for having me.